Okay, let's start off with your name, your job and specialty, and where you work.
Okay. My name is Jordan Franklin. I am an RN. I work at Trident Medical Center in North Charleston, and I work in the Progressive Care Unit, or PCU, which is a step-down ICU unit.
What does your typical day look like at work?
My typical day, I usually get to work about 20 minutes early, just to look at my assignment, go over everything, kind of see what the plan is going to be for the night. And then I get bedside report from the day shift nurse. So our unit is a little bit different. We give a verbal report, and then we also give a paper to the oncoming nurse, and it's like an SBAR paper. So it kind of has like everything I would need to know on it, like their history, how much oxygen they're on, their diet orders, all those things. And then we also have to update the whiteboards while we're in there getting report. So after I get bedside report on all of my patients, I'll usually go back to the computer to look over everything again, look over the orders for me as a nurse, see if there's anything that I need to do for the patient specifically tonight. Sometimes we'll have patients who'll have procedures in the morning, so I'll need to know if there's anything on my end that I need to do to prep them for the procedure. After I look over all of that, and again, kind of get my plan together for the night, I'll look over what meds they're going to be getting. At nighttime, our patients will get their meds around 10 o'clock. Our patient population is a little bit older, so I try to start my med pass a little bit earlier, just so they can go to bed at an appropriate time. So I'll start mine around 8:30. While I'm in there doing the med passes, when I do my head-to-toe assessment as well, just to kind of get everything done at once. After my med pass is over, usually around 10 or 10:30 at night is when I'll start my charting, ideally, but it never goes the way that I plan it. I'll usually finish my charting around like 1:30, 2 o'clock in the morning, around then. 3 o'clock is our like downtime. That's usually when I'll take my lunch break or kind of just make sure that everything that I need to do has been done already. And then around 4 or 5 o'clock in the morning is when we have our lab draws due. Sometimes we have a phlebotomy team, sometimes we don't. If they're not on our unit by 4 o'clock, I'll usually start my lab draws and just do them all myself. Sometimes we have patients who have central lines, so those we just draw ourselves. And if not, then you have to actually stick them. And then after I finish my lab draws, I'll do the last med pass, which is at 6 a.m. So I'll start that on my patients. And then after 6 o'clock, if everything is done, some of our patients are on electrolyte replacement protocol. Day shift usually handles that themselves, but if I have the extra time, I'll usually start it for them. And just make sure that everything is done charting wise, and I'll rewrite my papers just so they're up to date and they look pretty for the day shift nurses that are coming on. And then I give report.
If you had to pick your favorite part of your job, what would you say it is?
My favorite part of my job is that I get to do a little bit of everything. So most PCU units don't get to really see a whole lot before patients are sent to the ICU. But at Trident, I get to see pretty much everything. We do a lot of cardiac drips. We do insulin drips. We do a lot of BiPAPs. We even have a few patients that are on vents, which I know that other units definitely don't do. And then we also have a lot of psych and drug addicts or alcoholics. Those ones are usually my favorite just because they're the bad ones and they're the most fun. So getting to like see all of that is always a good time. And then we do a lot of restraints too, which I know other units don't do. So just getting to see everything and then just constantly being able to learn more about all these different pieces. And I know that that's something that I was very adamant on, something I really wanted when I was looking for a job. I wanted something that I was going to constantly be challenged in and something that I was constantly going to be able to learn new things, and I wouldn't ever be stagnant or ever be bored. It was something that it would grow me the whole time that I was there. So that's definitely my favorite part.
Absolutely. And then on the other hand, what would you say the most difficult part of your job is?
The most difficult part is definitely time management. Like I described, ideally how I would like my night to go, but it almost never goes like that. Especially with all the psych patients and all the withdrawing patients and all the elderly patients, it's always someone's trying to get up out of bed, someone wants a ginger ale, someone wants this, someone's doing that, someone's oxygen's dropping. So it's never like I'm never able to just sit and chart. It's always interrupted.
Mhm.
And then also it's difficult being on nights because a lot of the physicians don't like to be woken up at 2:00 in the morning for a melatonin or for a Tylenol. So having to deal with that, but also looking out for what's best for your patient, like balancing the two of those, that's also pretty difficult.
If you could give yourself one piece of advice as a nursing student, what would it be?
I would tell myself that school doesn't define the type of nurse that you're going to be. I was not a very good student. I didn't do the best in nursing school, but I would definitely just tell myself just to get through it and to learn and absorb as much as you can, but not to worry about the grades as much, because a C in MedSurg 1 is not going to define who you are as a nurse in 3 years. No one cares. No one asks you, oh, how did you do in this class? How did you do in that class? It's how you take what you've learned and you apply it to your job.
Great. And then with everything going on with COVID, there's a couple questions related to that. Do you face any challenges on your unit with the current COVID crisis?
Yes. So our unit, or I've been very fortunate. So our hospital has not had nearly as many patients as the other hospitals have. Like I know the downtown hospitals have had the most. So our hospital itself hasn't had as many, and then my unit hasn't had as many. So the COVID patients in our hospital are either stable enough to be in the COVID unit, or they are not doing well at all and need to be like ventilated and they are down in the ICU. So there weren't too many that were kind of in the middle. So I, compared to others, I didn't see nearly as many of COVID patients, but we definitely had a few. But when it all first started, we weren't doing the like elective procedures. People were afraid to come into the ER, so we weren't getting that many admissions. So our patient number definitely dropped. So we were like sending people home early. We were calling people off or putting people on call. So we would cancel our traveling contracts, and then our part-time people weren't really getting hours. So they were starting to seek hours somewhere else. So now that our patient population is back up and we're at full capacity, we're very short staffed. So just having to deal with so we cap at 4 patients each. We don't go higher than that at all, but like now our charge nurse is having to take 4 patients. So being a charge nurse with the unit and just the acuity of all the patients on top of having a full patient load is a lot. And we don't always have techs. So having the full patient load and no techs and just being short staffed all the time is definitely something that we're struggling with. It's starting to get a little better just because we're starting to hire back more travelers. So we're getting a few here and there. So that is helpful. But just the combination of all of that, and obviously like some people getting sick. We've had a few nurses on nights get sick. We've had a few nurses and a tech on days get sick. So just trying to make sure that our unit is properly staffed is something that we have been struggling with. So that's pretty much it.
And have you faced any personal struggles with like your family or your outlook on nursing because of COVID?
I've been, again, very fortunate. No one in my family has gotten sick with it, but it's definitely affected how much I've been able to see them. So my family doesn't live very far from where I live in Charleston. I live about an hour and a half away. But during the pandemic, I wasn't going home. And my parents aren't that old. Like mom's 50 and my dad's like 52. But still just like the idea of just trying to keep them safe and staying away from them and making sure that like I'm being smart with my actions outside of work and in work, because I'm literally face to face with COVID. Sometimes I'll have a patient and I'm in the room and there's COVID in that room, and just making sure that I'm being smart with how I'm working so that if I wanted to, I could go see my parents, but still being able to keep that distance. So it's not the same when I visit them. And when I visit like my grandmother, I still haven't hugged her. I still keep a distance from her. So just being more aware of what I'm doing at work and being aware of what I'm doing outside of work, just to keep myself safe and then keep obviously those around me safe as well.
Yeah, great. Well, I thank you so much for all of your time, and I hope that you have a great rest of your day.
Thank you.